Um, yes, thank you, Nabajit, for joining us today. Hi, everyone. I welcome you to JR Analytics Medical and Health eLearning. My name is Dr. Jadamani Singh. I am the director of JR Analytics. Now, a big thanks to Doc Campus to host this interview on their platform. And I'm very pleased to welcome a very special guest, Dr. Nabajit Talukdar. And Dr. Nabajit is a senior interventional cardiologist based in Delhi. It is a pleasure to have you here with us, Nabajit.
My pleasure too.
Thank you. We know that the Global Aware Week was 15th to 24th of November, and today we will talk about atrial fibrillation, one of the most common cardiac arrhythmias encountered in clinical practice. We know that it affects millions of people, increases the risk of strokes 5 times greater for people with AF, and then those with non-AF related strokes are often, and AF related strokes are often severe with higher mortality and greater disability. So that is just a short introduction that I thought I should tell all the guests who have joined us today. Now, Dr. Nabajit, so we will start the interview with a very simple question. Can you explain in layman's term what AF is and how it can be detected cheaply?
Well, atrial fibrillation originates from the word fibrillare. To fibrillare means to quiver. It is just like, disorganized atrial activity. Like we have 4 chambers in the heart. The heart rhythm starts from the upper chamber on the right side near the superior vena cava. There is an area called the SA node. That area is the dominant starting of the firing of the cardiac cells or the electricity of the heart. Sometimes accessory areas of the atria, particularly the left atria, near the origin of the pulmonary veins, they trigger some abnormal impulses and disorganized atrial activity starts. So it means that your atria is not contracting as such. Atria has 2 functions. One is a reservoir function, another is a contraction function. So it doesn't contract as such, it contracts something like this. So this is a disorganized atrial activity, and hence it can cause increased heart rate, it can result in palpitation. And the most worst part is, because it is non-effective contraction, some blood does stay in redundant areas of the atria and cause clots. These clots may travel to the ventricle and then forward in the systemic circulation, either to cause stroke, that is clots in the brain, or embolization to different areas of the body, including the peripheries, the limbs, the kidneys, etc., and so on and so forth. Although I have tried to tell you in a very short thing, it is not as simple as that. It involves a lot of complex mechanisms, but in an essence, it is this. Something called the pulse deficit. Means if 2 persons, one person sees the heart rate and other person sees the heartbeat, and they compare the two. If the difference is more than 10, means if the difference is more than 10, which is called the pulse deficit, then atrial fibrillation is confirmed. The other sign clinically is to see the JVP or jugular venous pulse. In the jugular venous pulse, we generally see 2 upstrokes, A and V. The A is because of atrial contraction, and in atrial fibrillation, atrial contraction is lost. So loss of A wave or monophasic JVP, irregular pulse with a pulse deficit of more than 10 is the clinical definition of atrial fibrillation.
Yes, thank you very much for the simple explanation. Now my question number 2 that I'm going to ask is just as a part of the atrial fibrillation awareness week that has gone. Hearts for Heart here in Australia, they've organized a pulse and heart rate testing at hospitals and pharmacies around the country. And this year, because of COVID, they have launched and filled the big smartphone app free to the general public that allows you to check the health of your heartbeat from the comfort of your home and to see if you are at risk of atrial fibrillation. Are there such initiatives around atrial fibrillation in India? Should there be more awareness initiatives in India?
Yeah. Actually, in India, we are plagued with a very large population, near about 2 billion. So, any programs for such a large population is actually difficult. However, many of the efforts are being taken, particularly by the privately run agencies, and wherein we have used a multiple array of devices and multiple systems. One of the systems, as you all know, is the Apple Watch, which enables you to see the rhythm. Many a times we are using simple methods, like during the COVID time, pulse oximeter use has increased. Almost every house now has a pulse oximeter. So, like I have used pulse oximeter like I have just told the patients to put on the pulse oximeter, give me a video call and just show me the pulse tracings. This is one of the simplest ways. Pulse oximeter costs you 800 or 900 rupees in Indian. It is a few dollars only. So yeah, you can easily use this technology. Of course, ECGs are there. We have something called the patch ECGs, where you can apply a simple patch on the chest, and we can monitor the heart rate. We can monitor the 12-lead ECGs over a period of 7 to 10 days. So many a times intermittent atrial fibrillation, or a not atrial fibrillation, which is sometimes there, sometimes not there, somewhat not very regular in occurrence, can be picked up by such remote sensing things. So variety of technologies are available. Sort of AI systems are available. We have to gradually adopt those use and then go on. Most important part is actually to improve the awareness of atrial fibrillation. Globally, the awareness of atrial fibrillation, people know what is atrial fibrillation, but when it comes to application, it is very less. Even with the best of systems, the less than 50% of the persons afflicted with AF knows that they are in AF. And out of that 50%, another 50% are not adequately treated. And in persons who are not adequate, who are also treated, effective drugs, including oral anticoagulation, are not used in 30 to 40%. Now, this is the best possible data worldwide, but still, the lot needs to be done, and awareness such as you are doing. You are doing a great work by increasing the awareness, transcontinental, I know. So it's great. It's great.
Yes, no, that's right. I mean, it's very important, the awareness of atrial fibrillation in the public, and it's so important because by knowing if you have got atrial fibrillation, there is a good prevention of stroke. So we should be able to do much more awareness in India, especially in those people who are above 50 and who have got high risk of developing atrial fibrillation. Now, yes, as we know, making people more aware of the symptoms of atrial fibrillation can help with early diagnosis and treatment. Now, that's reducing the risk of stroke, as we have just spoken. What are the risk management through lifestyle intervention? Like, how can we reduce certain risks? I mean, it's very hard to reduce atrial fibrillation, but there has to be some lifestyle that we can have to intervene and to reduce the risk of AF and it.
One of the most important predisposing factors of AF is hypertension. Now, hypertension is particularly important in India and Southeast Asia because our population gets afflicted by hypertension 10 years earlier than the Western counterpart. So, the burden of hypertension per se is more than the Western world because a lot of younger people are affected. And whenever the heart is subjected to increased blood pressures quite early, as long as 10 years early, then the chances of atrial remodeling and adverse remodeling happening in atria is more. So the incidence of atrial fibrillation is more. Similarly with diabetes, India is set to become the diabetic capital in another 3-4 years of time, as well as large burden worldwide and in Southeast Asia, particularly the Asia Pacific region. So we have to increase the awareness and reduce the incidence of diabetes as such. Then comes smoking. Smoking is a factor which is importantly related. More so is alcohol, particularly binge drinking. Regular alcohol intake might be good, as is seen in physician heart study, nurses health study, etc., etc. But then, binge drinking, which is very prevalent all around the world, has been a cause of atrial fibrillation. In fact, there is a term called holiday heart. Holiday heart syndrome is typically atrial fibrillation occurring after binge. So these are important factors, namely diabetes, hypertension, early monitoring and disease control. The heart failure, undiagnosed coronary artery disease predisposing to heart failure. In fact, when you see the risk stratification score of atrial fibrillation, which is the Charles 2 VAST2 score, heart failure is one of the most important things. Of course, age we cannot change, male sex we cannot change, or female sex we cannot change. But aging and the process associated with it, we can detect. Hypertension can be easily treated. Diabetes can be easily treated. Excessive alcohol use can be easily treated. So these are simple things wherein we can go for early detection of risk factors and effective management of coronary artery disease, preventing heart failure from occurring, and thus reduce the atrial fibrillation burden.
That's right. Now, and the next question again, since we are talking of so now, how important is assessing comorbidities in atrial fibrillation? How do you manage? Yes, how do you manage elderly patients with atrial fibrillation and multiple comorbidities?
Yes, comorbidities is very important, particularly in the elderly age group. One of the important factors of aging is a decline in renal function, and it has been seen that worsening renal function has been attributed to worsening outcomes in stroke. As age progresses, our arteries harden. There are multiple changes. There is progression of atherosclerosis, and hence the atrial fibrillation and its related stroke risk also increases. So, if we reduce the occurrence of atherosclerosis and if we see the vascular health as such, then the occurrence of atrial fibrillation is lesser. As I have alluded to earlier, early effective treatment of hypertension, reducing the baseline heart rates and reducing the atrial remodeling by treating the diabetes, by treating the heart failure. Nowadays we have advanced treatments of heart failure, namely beta blockers, SGLT2 inhibitors, the neprilysin system inhibitors and all. We can reduce the heart failure burden. In some cases, the device therapy and other things, the LVAD and many other things, we can effectively treat the chronic heart failure symptoms patients. Then an important subset is the hypertrophic cardiomyopathy. Now, hypertrophic cardiomyopathy would be stable for years, but until the occurrence of atrial fibrillation. Because when atrial fibrillation occurs, loss of atrial kick occurs, hypertrophic cardiomyopathy patients behave very badly. Apart from 3 to 4 times increased incidence of stroke compared to general population, the general mechanics of hypertrophic cardiomyopathy worsens. Of course, in areas of New Zealand, in areas of Australia, and in some like Uttar province of US, and of course in India, the rheumatic heart disease is still prevalent. We cannot forget that. Rheumatic heart disease patients with stroke, they have 7-fold increased mortality or 7-fold increased stroke risk as compared to normal atrial fibrillation. So, the effective treatment of rheumatic heart disease is also important.
So, it's very important to assess comorbidities in atrial fibrillation. We have to understand all the cause of atrial fibrillation from the atrial itself to the cardiac causes and also other causes like DVT and chronic venous thrombosis and also hypertension and as you have told.
Jatudha, I'm sorry to interrupt, but then with the current scenario, especially in COVID era, we have treated a lot of COVID patients. Atrial fibrillation is also the commonest arrhythmia seen in COVID patients. Probably, and we have seen those in normally normal size left atria. So there is some association with inflammation. So
Yes.
COVID, because it causes diffuse endothelialitis, also
Yes.
predisposes to AF and increases
Yes.
mortality in such patients.
Yes, I mean, unless he has not developed viral myocarditis secondary to coronavirus, which is very rare, but in the younger generation mostly. But yes, you're absolutely right. Now, most international guidelines now recommend direct oral anticoagulation therapy in preference to the previous one that we used to use, like warfarin, especially that are now and non-valvular atrial fibrillation. A recent study has also shown higher risks of all-cause mortality with atrial fibrillation. Now, with non-recommended dose of DOACs or the direct oral anticoagulant, what is your experience with NOAC and DOAC uses in atrial fibrillation?
Well, NOACs and DOACs are now the standard of care of non-valvular AF or NVAF. This is because when we see the data with warfarin and in some countries with iscomarin, we have seen that the overall incidence of, because when you use these drugs are effective, but it has disadvantage because you need frequent IPT and INR monitoring. And you have to ensure that at least there is 80% TTR. TTR means time in therapeutic range, which in the best of the centers it is difficult to achieve. So NOACs were developed wherein the direct oral anticoagulants, they don't need frequent PT-INR monitoring, and hence the TTR improves, time in therapeutic range improves, because the dosage is simpler, and you don't need monitoring. The dietary guidelines are also less stringent. You don't need all those evidence of vitamin K producing foods so much. You need to have milder kind of restrictions. And when data was found in the Relay trial, Rocket trial, Aristotle trial, and of course the Epixaban trials. Epixaban is not available in India, so we have not used it. In the other three are freely available, and with these data we have seen that the comparable, if not more, efficacy with the novel oral anticoagulants. This comes with added advantage of reduction in intracranial hemorrhage. You have to realize that one intracranial hemorrhage will leave you paralyzed for life. So, to reduction of, you are giving the drugs to reduce stroke, means ischemic stroke. But in the process, if you produce a bleed in the brain, this is bad. So that is the advantage of oral anticoagulant. One, no frequent monitoring is required, reduction in intracranial hemorrhage, and of course better efficacy and easier lifestyle process.
Yeah, and also easier for the patient that they don't have to go and do all the blood tests every few days
Yes.
or every once a week. So it's much more reliance and much more compatible with the patients to undertake all this.
In fact, there is a new trial going on called the Invictus trial. The Invictus trial is trying to show warfarin superiority. But as we are also somewhat involved with the trial, the Invictus trial till now hasn't shown any encouraging data towards that. Of course, it's too early to say, but then unlikely to be showing overwhelming benefits of warfarin.
Yeah, that's true. Yeah, so so that's it's very important that we understand atrial fibrillation. So, like now we have wearable devices with optical sensors, such as smartwatches, are now commonly used to measure pulse rate. Like Apple Watches has got intermittently passively detect pulse rate data in the algorithm, and then it identifies episodes suggestive of atrial fibrillation. Now, what do you think of the role of AI or artificial intelligence and machine learning in arrhythmia diagnosis and management?
Of course, with the world turning into a global village, and with all remote teaching, learning, conferencing, school education, college education through remote sensing devices, as well as device held world. So it becomes imperative that artificial intelligence comes into play in the detection and diagnosis of as disease which is as prevalent as atrial fibrillation. Smartwatches are one. There are portable ECGs. There are apps both in the Apple watches, Apple phones, as well as the simple Android phones like the Google, Google phone or the Samsung. So Samsung has got its own app. Multiple apps are there. We can design apps. Then, of course, like what we used to do in remote areas, they might not have the costly phones. So what we have used simple devices like pulse oximeter. The patient puts a pulse oximeter in the finger and just shows us over the phone that what is happening. This is very simple. Of course, scene, as I told, the absence of A wave in GBP, the irregular heart rates, and the pulse deficit more than 10. This will also see in the detection of heart failure. Apart from this, you can directly use many other things like patch ECGs. Patch ECGs can transmit the data directly to your phone. There can be an app on the patient's end. They just put the sensor. Some companies have the sensors, the tip health center. Some companies have direct. You can put the phone over here, put on the app, and this is directly connected to my phone, and then we can detect there. So there is miles to go. We can actually do wonders.
Yes. So, like the AI in especially in atrial fibrillation, machine learning and AI in atrial fibrillation, because these are technically very specific determinant which are measured by all the what you call ECG columns and differences, basically by 0.04 millimeter square, and that's why it is very easy for AI to understand, learn the whole system whether it is atrial fibrillation or not. And it's very easy for the machine nowadays to understand the RR, distance of RR, and or whether you take TP or RR distance to read the heart rate and tell you whether it is regular or irregular. So, and most important thing to understand in atrial fibrillation is to get to know that you have got a heart rate which is irregular. Now, a holistic approach in atrial fibrillation, patient care, and stroke prevention. As a sort of general holistic approach, what do you think would you advise to those people who has got atrial fibrillation and also their care and stroke prevention?
Of course, holistic healing is important because atrial fibrillation is not one disease. It is not only the arrhythmia. There are some genes like ATFib1 and ATFib2. They are implicated with atrial fibrillation. Now, there are some syndromes like short QT syndromes. They are associated with atrial fibrillation. In fact, it's genes encoding atrial fibrillation and short QT syndromes are same. They have the same locus. Yes. Then you have the diabetes, hypertension. Then in elderly, the prevalence of Parkinsonism per se will cause increased atrial fibrillation because of changes in the neurohormonal status. Heart failure, as you know, portends increased risk and increased experience of atrial fibrillation. So, holistic approach means not only treating the atrial fibrillation with rate control, rhythm control, and the oral anticoagulation per se, but it also would mean treatment of permanent atrial fibrillation by various methods like the EPS, electrophysiologic study, radiofrequency ablations, etc., etc. Apart from these complementary therapies, like calming the mind, soothing the mind, evidence of direct toxic agents, evidence of excessive tea, alcohol, etc., will help in many ways towards reducing the atrial fibrillation.
That's right, and also just to add on that, for those who are present as who has come to attend this meeting, it's very important that AF is understood, because stroke prevention is paramount, especially in those people who are plus 50 and who already has got the atrial fibrillation. It is very important that they continue to monitor and continue to see their doctors so that they can control their atrial fibrillation and avoid any kind of thromboembolic phenomenon. Now, atrial fibrillation, includes avoidance of stroke, which is most of the time that we are trying, and better symptom management. Now, a combined left atrial appendix occlusion and catheter ablation procedure, as you have just mentioned, potentially offers a one-step solution that addresses both of these management goals. Now, which patients are suitable for combined management of atrial fibrillation?
Well, this is a very dear question because this is what is the flavor. Because us who are practicing this field, we know.
Right.
See, the ablation for atrial fibrillation has come from a point where it was only 50% effective.
Right.
With the introduction of cryo, the cryo system has now reached India, and cryo catheters are available. Of course, the cost is more. It is only a matter of time that the cost will come down. Now, atrial fibrillation ablation, as compared to 10 years earlier, is much more simpler now. We have algorithms and we have different hardwares available for atrial fibrillation system. Like we are using many times we can use cardio system to effectively map the heart and then go for atrial fibrillation. We have dynamic dynacity where the combined images can be used to see the pulmonary veins, identify the rostia, and cause mapping of the atrial fibrillation easier. With cryoablation and basket cryo system available, now you can just simply put one catheter into the left atria, inflate the balloon, give multiple cryoablation, and phew, the atrial fibrillation is gone. But you have to selectively choose the patients. If the atria is very large, if the atria is more than 40 centimeter or 40 millimeter in size, the success rate dips, right?
Yes.
Because there are many fibrotic areas in the atria, and hence you have to see very large atrias might not be amenable to this. But moderately sized atrias are amenable. Then among the appendage device closures, there are 6 types of appendage. So out of these, 4 types are more amenable to successful device occlusions. So those 4 types needs to be identified. It is very easy to identify. Simple CT scan or an angio run during the procedure can identify it. Yes, this is the feature of atrial fibrillation. Now the success rate has approached 70 to 80% in certain centers with regular operators who are skilled at doing that. So this is the future. Combined approach of atrial fibrillation mapping and then ablation along with left atrial appendage occlusion. But of course, one should also mind that even in left atrial appendage device, we need to give oral anticoagulation at least for 3 months to 6 months. We have to do. So only after that we can slowly, when the appendage finally closes, when we see no evidence of clot, etc., then only we can slowly take out the oral anticoagulants. But yes, it is the future. Till now, it is the future.
Interesting, very interesting topic. Now, I've got some question from the audience. Chitaranjan has given one question. He's asking, he wants to understand why there is a new phenomenon of cardiac arrest in top athletes. He saw one falling down in the Champion League, which he is very much concerned. Should we stop over exerting? Now, I'll just give you a quick answer, and then Nabajit will give you the answer as well. Now, Chitaranjan, any kind of people, so let me just give you a background history is that in India, most of the people in India, we are 50% high chances of developing cardiac diseases. Not only cardiac, but diabetes. Now, if we go back to our history will show that most of our parents, many of our parents or family has got cardiac issues and diabetes. So we already have got more than 50% chances of developing cardiac disease. Now, so you may not have any symptom during that when you are young. Even if you have minor, as I said, as we were talking about atrial fibrillation, you think that your heart has skipped, but you would not worry about it. But it is important that if you have got history, family history, if you have any issues with cardiac, you should go and see your doctor, and before you go and do any kind of over excessive exercise. I think any exercise is good. Over anything is not good, but I think everything in moderation is always better. But definitely, any people who are worried about, after seeing all these athletes collapsing in the field, they are not because they don't have a history. We don't know and their history, but if you go back to ask them questions, they will definitely have some kind of history. So I think this is very important, and I will leave it to Dr. Nabajit to answer the rest of the question.
Yeah, actually, it took millions of years for us to evolve as human. So it involves multiple processes. The cardiac remodeling and cardiac adaptation to different kinds of environment needs remodeling. Now the important trend is formula fits, and suddenly we want to have a toned up body within 15 days. We want to become an athlete within 7 days. So these are dangerous trends. These are actually pushing your body off the limits. We only understand part of the body. We don't understand the entire physiology to an extent. The protein supplements, various kinds of supplements, these are non-physiologic products to the body. They cause endothelialitis. High trans fat intake cause endothelialitis. High intensity exercise as such causes, you have to understand certain things. Like rabbits, their heart rate is 180 to 190. They live only for 8 years. You know? So you have a fixed number of heart rate. How much heart rate you accelerate, your body will last that long. Like a car, if you continuously run on top gear, it will wear out faster. Similar is your heart. If you make it run very fast over a prolonged period of time, you have got incidents. Along with this, certain genetic variants like hypertrophic cardiomyopathy, some genetic syndrome, some other family history are easily looked onto. So we need to have a relook, as Jaduda has already told you, we need to have a relook at this and understand it in a deeper way.
And to bring awareness to the young people.
Yeah, we have to see that podcast doesn't happen. We have to avoid getting, dream of getting a toned up body, a fixed body within this thing. If you want to have a good body, fit body, you should start from early childhood. Yeah, and exercise and other things are regular processes. You have to.
And even if you want to do exercise, if you have got history in your family, and before you go and do any kind of what you call lifting very heavy stones, just talk to your doctor, have a quick chat with him, tell him that this is what you want to do, but you have got this history in the family. Can we have a quick check? So I think that will help you to understand if there is anything in your system that may cause any other issue.
Of course.
Now the second, sorry, you have anything? Yeah. Now there's a second question. Do you use the big graph trans in the reversal of the DOAC and NOAC in Delhi now in India?
No, I can understand the question. Yes, reversal agents are available. In fact, the companies who are selling dabigatran, they are ensuring the patient that if bleed happens, the incidence of bleed is less than 1% currently. Even if any bleed happens, the reversal agents can be given. Actually, now universal reversal agent is available, so you can also use that. But I can assure the risk of major bleed, I have seen only one bleed in last 10 years or so.
That's right.
So the minor nuisance bleed are there. GI bleed sometimes we see, and it is manageable also. But then serious intracranial bleed are exceedingly rare, not as high as we used to see in warfarin days.
That's right. Now there is another question from Chitranjan. It's a second question. Now he wants to know if there is any approved medical sort of instrument for measuring what we call heart rate and approved by Indian Medical Association to monitor your atrial fibrillation or heart rate at home. Now, as far as I know, just to continue with the question, there is no approved by the IMA or even by the FDA approved. Now, recently Apple Watch has just recently been approved by the FDA. Now, in India we have got the patch monitoring system. So I think many of them are still not approved by IMA. Some maybe, I don't know which are, but they are available in the market. But they are also, you just put a small patch and you can monitor through your smartphone. Even though they are not approved by Indian Medical Association, there are many glucometers which are also not approved. But what you can use them if you have any history of atrial fibrillation at home, which you can show all the results to your doctor, to your patient. What do you think about that, Nabajit?
Yeah, the Apple Watch, actually FDA has approved the Apple Watch for rhythm monitoring and intervention. It is a very recent phenomenon, in past 1 month this has happened. In fact, there has been a trial which shows the effectiveness of the the watch monitoring system over other systems. So it goes without saying, whoever has access to an Apple Watch can easily do that. However, we must understand that all things cannot have an evidence. Like you don't have an evidence whether temporary pacemaker helps you during the complete heart block or not, because it is simply unethical not to put temporary pacemaker in complete heart block. Similarly, you don't have any trial to show that parachutes help while you jump out from an helicopter. So you cannot have data for all. Yes, the effectiveness of atrial fibrillation management is will be there because there is no other diagnosis. Irregular heart rate, the irregular RR interval, absence of P wave in the ECG is atrial fibrillation until proven otherwise. So these things doesn't need much of a validation. We can use the technologies, whatever is available, and then you have the patch system, you have the app system, so you have the pulse oximeters, you have the plethysmographies, you have multiple devices. You can use even a simple Doppler probe to see the sounds. You don't need to see also. Even hearing the sounds, you can detect atrial fibrillation.
That's right. Now there is another some more question. How do you maintain patient compliance of medication in atrial fibrillation?
This is an important question because most of the atrial fibrillation patients are elderly. They have multiple comorbidities. They have multiple medicines to be taken. So compliance is an issue. So for compliance, we use multiple things. We sometimes enroll them into some programs. Like I have one of the programs wherein there is actually a caregiver company who telephonically monitors the patient, and there is a nurse who regularly calls up the patient, ensures medicines. Sometimes we want to see the empty, blister pouches, how many medicines have been used. Sometimes we use boxes where the certain number of pills are taken, and morning, evening, night, timing, along with the timing, we can check those. And then we have cross and recross, like we can always employ one of the family members to ensure that medicines are given over a time and the patient has taken medicines. I personally have 2 patients who are telling they were having medicines, but they used to hide their medicines behind the pillow. So you have to go to crazy lengths to ensure this. Many innovative ideas are also required. Sometimes in 2 cases I have used their grandsons and granddaughters because they were mostly in the house during the COVID period. I have employed them, taken them into confidence, and see if your granny is taking medicines or not. So those things are personalized approaches are important. But yes, regular program in terms of home care, regular monitoring with daily nurse visits, or at least a virtual visit, or at least a virtual calls, the checking of medicines, ensure daily medicine supply, monitoring their problems are important in management of heart failure.
Yes, so probably with COVID may not have given us many things, but at least one thing that has probably improved is the telemedicine that we have developed in these last 2 years, and which will definitely help a lot of people, especially who are who want to talk. Like today in Doc's campus, I think we have been connected to a lot of doctors around India, and they can even the patients they can log in and join the Doc campus and ask questions to the specialist, which they wouldn't have the chance to ask if there was no telehealth or telemedication. Now, I've got another question from Omkar. He says that is sedentary lifestyle responsible for heart failure in adults, and how? Now, just to give you a background, now sedentary lifestyle it's a very generic term. Now, for any kind of heart failure to occur, and there has to be some subset of something happening in your circulation. Either you are hypertensive or you have got some other issues with the heart. Now, if you are just sedentary, you may not die of heart failure, but you may not be as healthy as you would like to be. Little bit of exercise always gives the heart pumping much better than without doing any exercise. So yes, the sedentary lifestyle may not cause direct heart failure, but in a longer run, if you don't look after yourself, yes, it will cause heart failure. And the mechanism is very huge, but let me ask Dr. Nabajit.
Man is not designed to be sedentary. You have to understand that the entire animal kingdom is not designed to be sedentary. Even the sloth bears, they move. Even though they move slowly, they move. So the essence of life is movement. You cannot be sedentary. So whenever you are sedentary, you increase your chances of atherosclerosis, you increase your chances of hypertension, you increase your chances of diabetes and whatnot and what more. So sedentary lifestyle does increases chances of not only the determinants of atherosclerosis, but also the heart failure risk and as well as the atrial fibrillation risk.
Yes, sir.
So sedentary lifestyle has to be avoided at any cost, and some form of regular exercises or some healthy adaptation of lifestyle is important.
Yes, sir. Absolutely. And a little bit of walking, the 10,000 step, which has been started many years ago, which many people around the world use still today, the scientist has come back and said up to 5,000 steps take in a day is also much better than not taking any steps. So I think if you can maintain a goal of trying to get 5,000, 10,000 steps every day, which means that you are no more sedentary, that will help you in the long run with your heart. And as we have discussed earlier, any kind of excessive exercise without proper investigating yourself is always risky. We have seen quite a few people who, I think in India, young people who has collapsed in the gym. And also, last time we also had a discussion that I think every gym should now be having automatic electronic defibrillator system, and everyone in the gym should be trained how to do BLS and how to use the fibrillation system. In India especially, I think we need AED in every public place where it can be used in case of any kind of cardiac arrest or anything like that. What do you think? I think it is important.
Yeah, it is imperative. We currently don't have any law regarding this, but I think we, from our cardiac bodies and other things, we are emphasizing on this law. On our own personal initiatives, like I have tried imparting the knowledge in my son's football club. I have tried imparting this knowledge in my lessons, karate schools, in their schools and all. Of course, at the school level, much more this thing has happened in last few years or so. People are slowly getting to understand things. Currently, with the spate of so many unnatural deaths happening in youngish persons, this becomes more imperative. We have to widely preach BLS to at least 60 to 70% of the population, so that at least every 1 in 3 person knows BLS. And the AD access in India will be a difficult proposition because it is such a vast country and our economy is not that. But yes, some start is going to happen. It is starting.
At least they are starting. I mean,
it is starting. Developed worlds have already taken up this, and we are starting.
Even in India, in the airports and stuff, I have seen.
You have in advanced corporate buildings and airports and all, you have. But having it in every gym is a long dream now.
So, we know that atrial fibrillation causes, I think, about 6,000 strokes every year, actually. It is really important that we continue to raise awareness and those who have joined. as well. It is very important that we detect the detection and management of AF, have increased nationally, and it is preventing hundreds of avoidable strokes and death. And it's so important that it has prevented many deaths and many strokes. The management of modifiable risk factors include obesity, smoking, alcohol intake, and physical inactivity, which we just discussed, is an essential component of management of atrial fibrillation. Now, a number of studies have shown that patients with atrial fibrillation who successfully manage their risk factors demonstrate a significant reduction in AF symptoms, were more likely to have successful outcome following ablation. So, lifestyle intervention, even if adopted in moderation, can make a very big difference. Now, thank you. Just a final thought, if you have anything you want to say, Nabajit.
Yeah, thought means you have already summarized it so nicely. We need a holistic approach. We need earlier detection. We need increase, awareness, increase acceptance of drugs, and compliance to medicines, which will go in long way, along with adaptation of newer technologies and newer treatment methods, such as there is actually some inertia towards acceptance of the ablation procedures and the atrial appendage devices. Those inertias has to go. Ablation is a fantastic method for atrial fibrillation management, and we have slowly to go. Actually, till recently, it was rhythm control and rate control is similar. Although it is similar, this is not so. Sinus rhythm is sinus rhythm. In humans, we are designed to have sinus rhythm. So we are not horses. We are not rabbits to have permanent atrial fibrillation. So horses have permanent atrial fibrillation. We are not designed like that. We are not. So we need sinus rhythm, and sinus rhythm should be the goal.
It was great meeting you and talking to you very much, everyone. Thank you, Nabajit. Thank you, Dr. Campus.